meeting that we have, a regular discussion of issues important in medical librarianship, health literacy, and health information. The webinar is hosted by NNLM Region 4, based at the University of Utah, Spencer S. Eccles Health Sciences Library. My name is George Strawley, and I am the Library Engagement Specialist for Region 4 of the Network of the National Library of Medicine. Our presentation today is the health information landscape for Mullerian anomalies, highs and lows for women with a complex reproductive diagnosis. By the way, I did make a mistake here, and it's actually on September 14th. Today is September 14th. But our team of guest speakers with clinical, medical, library research, and education expertise will present the results of their work identifying the availability and suitability of online health information for women with Mullerian anomalies. Mullerian anomalies are congenital anomalies of the uterus prevalent in approximately 7% of the female population. This will include an overview of the condition, findings from an extensive audit of online information, and an analysis of the patient suitability of that information. The team will also describe health information insights revealed throughout their process that, while specific to this particular health condition, are likely applicable to a range of other patient populations with less commonly diagnosed conditions. I have just a few informational items to cover before we get to our presentation. Before we start, you might want to locate and open the chat box. It's closed by default. Look for the chat bubble icon on the bottom of your screen. We have captioning available today. Click the CC button at the bottom of your screen if you would like to view them. We're recording today's session. It takes up to 30 days to edit and caption the video. We'll send the link to the recording to all registrants when it's available. And finally, we will provide a link to the evaluation in a few minutes, and again at the end of the session. Completing the evaluation is the first step to claiming Medical Library Association continuing education credit for the Certified Health Education or the Certified Health Education Specialist credit. Okay. So with that, I'm going to introduce our lead speaker. Miranda Margetts is at the Montana State University Center for American Indian and Rural Health Equity. Welcome, Miranda, and if you could introduce your team, that would be great. Take it away.
Thanks so much for the introduction, George. Firstly, just on behalf of my colleagues and co-presenters joining me today, I'd like to thank you and the NNLM Region 4 team for this opportunity to be featured in this Connections webinar. I'd also like to thank those attendees who've opted to join us today to learn more about Mullerian anomalies and the important work our team was able to undertake with the support of an Engagement and Outreach Award from Region 4. So the project team I'm here to introduce to you today. My colleagues are all kindly co-presenting with me, and each have contributed their various expertise to aspects of this work. As George has already mentioned, my name is Miranda Margetts, and I work with the Center for American Indian and Rural Health Equity at Montana State University, which is based in Bozeman, Montana. I'm joined by Bethany McCarter, who also works with me at CARE. That's the acronym for Center for American Rural Health Equity, so you might hear us refer to CARE throughout. Bethany is a research associate and has been a collaborator on several National Institutes of Health funded women's health and environmental health focused research projects through MSU. Nicole Holt is a community health major and a senior at MSU with a strong interest in rural women's health. And Nicole plans to pursue a graduate Masters of Public Health and Masters of Public Administration program later next year after she graduates. Dr. Alavash Magida is the Chief of the Division of Pediatric and Adolescent Gynecology at Yale School of Medicine, and she's also an Associate Professor. Ala has extensive experience caring for young girls and women with Mullerian anomalies. And Alyssa Grimshaw is a clinical research and educational librarian at Yale, and she's also an MPH candidate at Dartmouth. And Alyssa's played an extensive role in this project, given her librarian expertise. So each member of our team has a strong interest and experience working in women's health from various clinical research and educational perspectives. And we've worked together for several years on various projects. I also want to let you all know that I was fortunate to learn about NNLM Region 4 and their engagement and outreach awards through my work with CARE. And we jumped at the opportunity to apply for this award to complement the previous and current research work related to Mullerian anomalies that we're undertaking, specifically to begin to focus on health information aspects for women with Mullerian anomalies. And as Ala will go into in her talk, we know that this population is a recognised health disparity population for National Institutes of Health research purposes. So today's focus, we're going to share with you the outcomes from our award. The overarching goal of our project was to identify the health information gaps and opportunities to support optimal clinical care and education of females diagnosed with Mullerian anomalies. We sought to gain a greater understanding of the health information resources, including NLM resources, available to females with MAs and to the healthcare providers caring for this population across Region 4. As part of our presentation, our team will provide a clinical overview of the condition, the specifics of the health information audit process and outcomes that were undertaken to achieve the goals. And this also included analysis of the patient suitability of the information. And we'll also share lessons learned from a health librarian's perspective. Although we do focus on this particular population, we do expect that our findings could be applicable to various patient populations with less commonly diagnosed conditions. And so we therefore hope this is of interest to our audience members today. So with that, I'm happy to pass over to Dr. Vash Margetts, who will provide a clinical overview of Mullerian anomalies and continue to describe the importance of this work. Thank you, Ala.
And thanks, everyone. So I am a clinician on the team, and I take care of girls and of all ages, including young women and adult women with Mullerian anomalies. So just a brief definition, these are anomalies of developmental anomalies of female reproductive tract. Simply put, a uterus develops from two paramesonephric ducts in embryo, and if that process doesn't go well, the uterus can have different types, different shapes and forms, as you can see on this figure. It can vary from septate uterus or arcuate uterus, which are very minor abnormalities, to the severe phenotype where uterus is actually absent. And we'll talk about it in a little bit. Next slide. As Miranda pointed out, I also want to say that women with Mullerian anomalies fall under category of differences in sex development, and as such, they are considered by the NIH sexual and gender minority. NIH has a separate sexual and gender minority research office that aims to advance research on the health of sexual and gender minority populations. And we're hoping to do, and we're doing the same thing. Next slide. I wanted to share the story, and I'm not going to go into details, but this is publicly available on yalemedicine.org, and I'm so proud of my patient who is 18, who presented to my care with complaint of severely painful periods. And she was seeing her pediatrician. It was not until 2 years later, pediatrician ordered pelvic ultrasound, and she was diagnosed with uterus didelphys or double uterus. She had a known absent kidney, but it was not known that she has a double uterus until her adolescent years. So if you care, please go online, yalemedicine.org, teens struggle with Mullerian anomalies. You can read the full story. Patient is anonymous, but story is true. Next slide. And just to put in perspective, what our patient had is absent kidney, and uniformly there will be, so uterus didelphys, double uterus, the side where our kidney is absent will be obstructed with a oblique vaginal septum, And these girls will go through normal puberty. They will start menstruating from the hemiuterus, as you can see on this figure, that's not obstructed. But then the hemiuterus that is obstructed will keep menstruating, quote unquote, and collecting blood inside, and patient will present with severely worsening pain with her periods. And that's exactly what our patient had. Next slide. So what about prevalence of Mullerian anomalies? People may think it's not common, but it is quite common. If in unselected population, we don't really know true prevalence of Mullerian anomalies. From what we know in published studies, in unselected population, Mullerian anomalies are prevalent, occur in about 5.5%. If you move to a different population of patients, namely with history of infertility, that number goes to 8%. If you combine history of infertility and miscarriage, that number goes up to 25%. But like I said, true prevalence is not known and more work needs to be done. Next slide. So why does it matter and why do we care? And like I said, phenotype of these anomalies can vary from really not severe, such as arcuate uterus that has no implications in future life and obstetrical history and pregnancies, or imperforate hymen, which has low prevalence, but if it's diagnosed on time and surgically corrected, it really doesn't have any surgical complications. We touched on uterus didelphys that has about 0.1% prevalence. If it's present in a patient, the spontaneous miscarriage risk is about 32%, and preterm birth rate can happen in 28% of patients and cases. So it has meaning, and it has severe implications. Obstructed uterine horn, for example, is quite rare, but it can lead to second trimester pregnancy uterine rupture in 90% of cases, and that can lead to catastrophic internal bleeding and possibly death if care is not given on time. I touched on MRKH syndrome briefly. That's Mayer-Rokitansky-Kuster-Hauser syndrome. 1 in 5,000 of patients have this condition. Female patients will have this condition, so not so rare. If you think of a city of 100,000 patient population, you can do the math and think of how many women will be with this condition in that city. And that condition is when girl is born without a uterus. And that is a diagnosis that cannot and should not be taken lightly. There's like lifelong implications of that condition. Next slide. And so we're taking care of our patients, we undertook this study, which is a pilot study, and so far has been published only as an abstract. Dr. Margetts is part of this study. We conducted a survey asking our patients various questions, and namely trying to elucidate their experiences of how we as clinicians take care of them. And one of the questions was, what are the sources of information in addition to your doctor that you use to obtain information about your diagnosis? In our pilot study, we only had 20 respondents, but our results showed that in 55% of cases, patients received information or sought information on the internet or social media in 10%. And so this knowledge and other knowledge led us to the project that we will describe here, and I'll hand over to Alyssa. Thank you.
Thank you so much, Alla. So our project goals were to identify health information resources available to patients with Mullerian anomalies, specifically within Region 4. And to do this, we undertook a very exhaustive environmental scan using both a literature review and Google searches. Given that 55% of the patients identified internet as one of the resources that they utilize when looking for health information on Mullerian anomalies. We also did a quality assessment of this information using the HEMAT assessment tool. Next slide, please. So like every good systematic review librarian, the first thing I did was identify all of the potential key terms that we could use. And I actually adapted this from an unpublished systematic review that this research team is working on. So the goal of this was to create a easy plug and play list of keywords for my exhaustive Google searches. And you can see it was quite expansive. Next slide, please. Okay, so our first step was our Google searches, and the first thing that we did was we took the list of the terms for Mullerian anomaly each individually, and searched Google, adding them with each of the states. The next thing we did was use the U.S. News and World Reports to identify a list of providers, and this was very multidisciplinary because patients in this population could be seen by a cohort of different interdisciplinary providers, and we wanted to be as exhaustive as humanly possible. Next, we hand searched each of the individual healthcare sites in addition to searching Google because we wanted to make sure that we didn't miss anything. So we looked at any women's health information on these sites. And then we also identified key medical associations, both regionally and nationally and internationally, to see what other information would be available from these resources for patients. Next, we wanted to assess what was available from the National Library of Medicine and specifically looked at Medline Plus for additional information. And these were both searched using Google keywords and hand searched on the individual websites. Lastly, we identified that there was a lot of social media information coming up within the Google website, the Google searches. So we wanted to map this also. So in addition to searching Google for that, we identified groups or pages on Reddit and Facebook that may be of interest to this patient population. And we did a YouTube search for more information available for patients. Next slide, please. Another aspect of our research that our project that was really important was identifying key providers in the area. And so I will back up and say that this list did have some bias because we were looking for self-identified key experts. So there are definitely people within the region that are caring for these patient populations that, you know, it wasn't available in a Google search or any of the other things I'm going to list right now. So first, I took a literature search using our comprehensive systematic review Mullerian anomaly hedge, and we did. I did a affiliation location for all region 4 states to identify people that are publishing about Mullerian anomalies within this region. I did a website search on all of the key healthcare systems and providers to identify physicians that may have been identified as experts in Mullerian anomaly care. And then I took it a step further and we did searches on LinkedIn and YouTube to find healthcare system information and advertisements where they might be pinpointing a particular provider in the care of this patient population. Next slide, please. And I'm going to hand it over to Bethany to talk about the results of our audit.
Thanks, Alyssa. So the audit that Alyssa performed yielded 160 sources overall. The majority of these you can see were websites, followed by 48 videos found based on YouTube's search algorithm. Then we had 21 patient groups, 8 experts from the region who had pages explaining their research. This is broken down, including the area experts. We found the majority of resources were for one specific MA, such as uterine didelphys or the severe case of MRKH, while 37% were general and referred to either all or multiple MAs. Over 10% of the materials were infertility focused, and more than 5% were geared toward adolescence and pregnancy. Next, I'll zoom into the results from each subcategory, beginning with websites. And so we found that more websites provided information for all MAs or MAs in general when compared to all the sources that I just discussed. Websites also had more resources focused on infertility than adolescence than the other categories. Our websites could be broken down by websites from key providers, such as hospitals or infertility clinics that were in the region. Then we had professional associations, such as ACOG or ASRM. resources obtained from NNLM, and other, which were websites that didn't fall into those other three categories. I'm going to zoom into some of these for some insights as well, starting with the key providers. So we found that for the key providers, a majority of these resources came from Arizona, and more than half of their resources were from Arizona's Mayo Clinic. Also noteworthy were resources from Colorado, in which half came from Colorado Children's Hospital, which would be a key provider for adolescents. Associations was the second highest category for websites. And from this slide, you can see some of the different associations that yielded results for our audit, with ACOG making up the majority of those materials. Other websites included mostly informational websites or blogs, but also provided links to some podcast episodes. Next, zooming in on YouTube videos, the 48 videos were the maximum that Alyssa could find based on YouTube's search algorithm. And the majority of these videos provided information for one specific condition. Particularly, many focused on MRKH that Ella earlier described as one of the most severe conditions. Many also focused on pregnancy, but there were few geared towards adolescence or infertility. Of the 21 patient groups, most were tailored to one specific MA, and some of these had an infertility focus. There were no adolescent support groups identified or groups for parents of adolescents with an MA. Breaking this down a little further, we found that 62% of the patient groups were private. All of this was housed on Facebook, while the rest were public, and this included Reddit and a few other public forums. Finally, for the 8 regional experts or researchers, what we found were that half were university affiliated and half were hospital affiliated. Again, Arizona was the state with the most experts and included both hospital and university researchers. Now I will hand it over to Nicole, who will describe the assessment she conducted on the quality of materials.
Thanks, Bethany. So I used the Health Education Materials Assessment Tool, which contains 6 to 8 mandatory questions with yes or no answers, such as the material uses common everyday language and medical terms are used only to familiarize the audience with the terms. When used, the medical terms are defined. If visuals and numbers are used, then the 8th question is also applied. To pass the HEMAT, or the Health Education Materials Assessment Tool, then the yes responses are required for all questions. And if no is answered for any question, then the material fails. Next slide. So I looked at 80 sources for patients within the NNLM Region 4, and most did not pass the HEMAT. And so most of them did not pass due to question 3, which was if the material, I think it was question 3, like the material uses everyday language, and it also did not pass for being patient-centered, unfortunately. Next slide. So to determine the reading level needed, the level of education needed to comprehend the article, I used the Flesch-Kincaid calculator, which computes several statistics about a reading material and uses an equation to create an output of a source, an output of a score for the source, determining the level of education necessary to comprehend it. And to show an example of an output from the Flesch-Kincaid calculator, I had to analyze our webpage on the CARE website, the Center for American Indian and Rural Health Equity, where you can see that the average words per sentence, the average syllables per word, and other indicators were used to determine a final output score, meaning to determine that this website is for a college graduate. Next slide, please. So I input the article text for the 80 sources that I also analyzed with the HEMAT, and I found that only one of the 80 was at the 6th grade reading level, and only 6 were at a 10th through 12th grade reading level. And the rest, so about 73, required at least some college education to comprehend. And this shows that there's a disparity in health literacy, especially for patients without a college education. Next slide, please. So in the NNLM Region 4, there's a lack of access to suitable patient-centered information. Additionally, most of the information available is written at a college reading level, which excludes patients who do not have access to a college education. The lack of suitable education at an appropriate reading level can create barriers for patients to understand their diagnosis and be able to seek care for it. And now I'm going to hand it back to Alyssa.
Sorry about that. Couldn't find my mute button. All right, so we're going to talk about lessons learned from the librarian perspective. First is that it was very, very time consuming. So we had a very exhaustive list of keywords. I think if I had a do-over, I really would dedicate a lot of time to learning how to use a web scraper and automating some of this process. I also think that this would help because I'm not sure that the Google algorithm works the best, and potentially there was bias in the algorithm trying to give me materials it thought that I was interested in. I also wanted to highlight the unreliability of the YouTube search algorithm. As part of this project, we got very interested in the available information and quality of that information on YouTube. And so when we did the search, I went through probably about 200 or 300 videos using the next button on YouTube. I reached a saturation point where I kept seeing a lot of the same videos come up continuously, so I stopped searching. Afterwards, I used a web scraper to do the same search, and I actually retrieved over 9,000 videos to review. And so, you know, there's a lot of information on YouTube that's just not findable by potential patients that are searching for it. Next, I want to talk about helpful information that I used. So I should definitely caveat this with I am an academic clinical librarian. So consumer health was not something that was an expertise of mine, but I was really excited about the opportunity to learn more about consumer health searching. And I found that a lot of our associations had very helpful information. So first, the Medical Library Association, in particular, the Consumer and Patient Health Information Services Caucus. And I wanted to highlight one resource that they publish, which is the Consumer Connections. And I thought that this publication that they put out was very helpful, even if you're not focusing on consumer health. So I would recommend any librarian in the group to check it out, maybe track that one. Next, NNLM really had some great information that I utilized, in particular in their blogs and programs. And I wanted to highlight the Consumer Health Minute on-demand videos, which was on YouTube, which was really great because I could utilize them whenever I had a free moment to work on this project. Lastly, I just want to mention that don't be afraid to go outside your expertise. I learned so much as part of this project, and I have integrated that into my everyday consultations. And you know, it was really great to learn more, and I'm so happy that I took the opportunity. And I'm going to hand back to Miranda to talk about future directions.
Thanks, Alyssa. Our team obviously has a strong commitment to continuing our research, engagement, and outreach efforts, both with the patient and the provider community, to address the health challenges that are relevant to this community, in addition to the health information challenges that we were able to identify through this work. So I wanted to share a few of these with you so you're aware of what we're up to. We're currently working with additional NNLM funding through an engagement and outreach award to focus on the development of health education material for women with MAs. And we're specifically looking at the development of a set of frequently asked questions, which is going to be informed by patients and their providers via a Delphi consultation process that we're fortunate that Alyssa is leading for us, given her experience with these. And our team also continues to work via CARE and NIH funding to investigate the health care services experience through a qualitative study with patients with MAs in the Mountain West region. And this work also has a quantitative focus looking at comorbidities and health outcomes from electronic medical record data sets. And again, that's with hospital health systems within the Region 4 area. And we were extremely pleased to learn that the National Institute of Child Health and Development awarded an RO3 exploratory grant to our collaboration, which is led by Dr. Vash Margetts as one of the co-PIs of that work, to focus on the genetics of Mullerian anomalies and addressing the challenges of the bench to the bedside gap. So that's, again, a quantitative piece of research that we're doing, and that addresses one of the largely unknown aspects of the condition, which is the genetic and or environmental underpinnings of the disease. So as you can see, we're very eager to continue this work. And as we do continue to focus on Region 4, we wanted to let anyone listening in today know, and perhaps this is medical librarians across the region or even beyond, if either yourself or any healthcare provider colleagues you might be aware of that are interested to learn more about our work or to be involved, we really welcome you to contact us. So please feel free to either get in touch with George or put your name and email into the chat box and we can stay in touch with you. We really would welcome that. So next, I just wanted to give some acknowledgements. On behalf of the team, I'd obviously like to thank our funders, the NLM and the entire NNLM Region 4 team, particularly George Strawley and John Bramble, who have provided a great amount of support to each of us and who I've been fortunate to work closely with. In addition, we'd also like to recognise the ongoing support from CARE at MSU and also the IDEA Network of Biomedical Research Excellence, which we refer to as INBRE. Some of you might be familiar with this. They supported Nicole through a public health summer internship so she could focus on her HEMAT analysis. We also wanted to acknowledge the Dartmouth Masters of Public Health Applied Practical Experience program that has also supported Alyssa's involvement in this work. And we'd specifically like to mention Alyssa's faculty mentor, Dr. Tina Foster, as well. And finally, the real drive for this work needs to be acknowledged, and they are the patients with an MA diagnosis and also the providers seeking to provide the best care possible to these patients. So that wraps us up, and we come to the Q&A section now. But before we move into that, I would just like to thank you all for listening in. And I'd like to give a special thanks to Bethany for all of the preparation and assistance with the slide material that she's done for our team. So George and I now welcome your questions. If you'd like to put them in chat, or if you'd like to put your hand up, or just however you'd like to ask any questions, we welcome them. And George, if you'd like to jump in, just feel free.
Thank you, Miranda and team, for the for a great presentation. We do have one question in the chat. If you'd like me to start out with that, or would you like to? Are you able to see it there?
I can see it, George. Yeah, I can. I'll read that out. So it's from Sandy Bates. And the question is, did you break out how much of the consumer health information pointed to medlineplus.gov? And if so, was that one of the reasons it required a higher level of reading? Sandy notes that she's found since medlineplus.gov much more frequently jumps out to you and much frequently jumps you out to an association page where it is scientific literature to be read than the previous format of medlineplus.gov, which was mostly written for a 6th grade reading level. I think I might refer that to Alyssa and Nicole. Alyssa, would you like to take a stab at answering that?
Yeah, so in terms of all of the websites and pages and information, I don't recall one pointing to Medline Plus, other than what we found on Medline Plus. So yeah, I don't think that anyone is using that really valuable resource, and maybe we should reach out to healthcare systems so they could add it to their websites or into our FAQ that we're developing. And I will let Nicole talk about the reading level that came back on Medline Plus.
I am pulling that up right now. Okay, it's loading. I don't know if I did one specifically for them. No, unfortunately, I did not do one specifically for Medline Plus, but I just found some Medline Plus. I'm so sorry. So they actually got pretty low scores, which means that it is like a higher level of education needed to be able to comprehend. It looks like the average was about 12 out of 100, which is a very low score, which very much surprises me.
Thanks, Nicole. I'll jump to the next question, George. I'll just read this out to the team. So from Emily Vardell asks, where do you plan to host the FAQ document you're working on creating? And she thanks us for the work. Thanks, Emily. That's a great question. At the moment, our plan for this year is to develop the FAQs, and as part of our dissemination plan, we would like to work with medical librarians and the associations involved in working with the providers who care for these women, and also those sites that we mentioned, the patient groups, etc., to disseminate that. So we don't have the actual home for it decided at this point, but the plan to spread it out as far as possible is definitely on the cards. So if you've got any suggestions or would like to let us know where you think we should send them, we'd really welcome that. I'll jump to the next question from Holly Hudson, who is a health science librarian who is really interested in researching information behavior and information resources for patients with polycystic ovarian syndrome, known as PCOS. She is wondering if we have any additional best practices or advice as she dives into this research topic. So Holly, Dr. Vash Margetts, who's on the line, has a strong interest in PCOS as well. And as you know, Alyssa and Ala have worked together on a lot of these types of projects. So I'll hand to Ala first, and then maybe Ala, if you'd like to hand to Alyssa as well.
Yeah, thank you, Holly. That is a great question. And Miranda, you know me well. PCOS is one of my research and clinical interests. We don't have any work happening along this lines in PCOS, but what I know, there's lots of myth and legends about PCOS, especially about PCOS in adolescent women. And so I'm just, I would love to be involved in this project, and I will, specifically about researching information on behavior, I would hand it over to Alyssa. And Alyssa and I have many common projects ongoing, so this may be another one. Alyssa.
Yeah, so I would first start with, you would really want to define your scope of your project very clearly when you start out, because I could see this being a very, very big project. Mullerian anomalies are, a rare disease where I think PCOS, I know it affects significantly more, and I'm not going to throw out a number because I definitely will misremember what it is. So I know that there's a lot more resources online on PCOS. So my first thought is clearly define the scope of the project and determine what exactly you're looking for. So would that be, the Facebook groups and determining how the patients are sharing information, or the quality of information that's out there, or the providers that are caring for it. So I could see this being a really great research project. But yeah, I imagine that there's a lot of data, and it would be, trying to get through the big data to be able to find the common themes.
And I'll just add, Holly, like last month in August, there are new international guidelines that came out on PCOS. And those, I'm sure you know about them, but just for the rest of listeners, those guidelines comprise of like 27 societies throughout the world. And this is an update, the most recent update, if we want to have the evidence-based literature. So that's my go-to. But then the rest, the wild internet is just... out there with lots of myths. Thank you.
Thank you, Ala and Alyssa. This is a great follow-up question from Sandy, and Ala, I might direct this to you, but Sandy is asking which type of physician specialties would best be able to help with our research: pediatrics, OBGYN, family practice. So if you'd like to, give a bit of a talk about how the breadth of providers that see these patients. And
yeah, so in the short time that we had this, I couldn't allude to the sort of number of, thanks for that question. That's a great question. The truth is that these girls can present, mostly pediatricians. So spreading the knowledge about these conditions among pediatricians I think is a key factor, because it is not, and a lot of these girls will present with painful periods. And another old myth is that, you have painful period, just like cope with it, take Motrin and Tylenol. And unfortunately, I've heard that from patients and moms as advice from their pediatrician. And that may, that's okay, but it's not okay. So if there is a symptom that's like disrupting patients' quality of life, or even before that, it has to be addressed. And so back to the question. So it's pediatricians, gynecologists, general OBGYNs, and then delving into subspecialties, it's reproductive endocrinology and infertility, but that's much later, or pediatric adolescent gynecologists, which is doctors like me, urologists, because patients will present with bladder symptoms, nephrologists, radiologists, emergency room physicians. If girl presents with painful period or anything along her period, just image the pelvis. It is simple. I'm saying we as Society of Pediatric Adolescent Gynecologists, we have a national organization, and we are trying to spread knowledge and word. But unfortunately, even to this day, in my state, we hear over and over that the diagnosis has been delayed or misdiagnosed, and it takes 1 to 2 more years to come to the true diagnosis. So, website, internet is where people gather information. And I think putting correct information at appropriate level is the key. So hopefully we can make some strides towards that.
Thanks, Ala. And I also can tell from Sandy's question that she's interested to know which type of specialties, I might just be presumptuous here, but is potentially going to connect us with physicians that she's aware of. Following up from what you said, Ala, I would suggest that really any physicians who would potentially have an interest in this work would be helpful in the research, and particularly across Region 4, where there's such a shortage of specialist OBGYNs. In some previous work that we did, we looked at a Montana hospital health data set, and we could see that there's quite a high number of emergency admissions for women with Mullerian anomalies. So that goes back to Ala's slide where she was showing the obstetrical and other complications such as ruptured uterus and things like that. So if there is that delay to diagnosis, then you can often present as an emergency admission, which obviously in a rural area is not ideal. Ala, I don't know if you have anything to add to that, but we have other questions I can get to as well.
I'll just add that it's not just physicians, it's other providers. So advanced practice providers, APPs, nurse practitioners, PAs, nurses, even, nurses should suspect that in the office. So it's not just MDs, it's all other providers that need to be aware of these conditions. Thank you.
Thanks, Ala. And I think the other question that we had from Jocelyn that Alyssa has answered, but just so everyone knows, it was in relation to, and Jocelyn, really, appreciate you sharing that story with us of your diagnosis, and it was in relation to heart-shaped uterus. And I think that, as Alyssa said, it just shows there are so many variations of the types of anomalies and so many different terms. And some other work that Nicole has done for us has just found also such inconsistency in even definitions alone. So it just shows what a struggle in relation to not only having appropriate reading level, but just even understanding the terminology between what a doctor might tell you and what you then try to go and search for. I'll just go down. Ala, Sandy responds and says that she's been trying to get in touch with her pediatrics clerkship coordinator to do some library orientation with the students. So this might be a good talking point. That sounds great. And George is asking, can we talk a little more about the authoritativeness of those sources that are putting out MA information? Is it coming from the most knowledgeable people or others? That's a really great question that I think I might put to Alyssa, because there is, yeah, she was in the weeds with the audit. Alyssa, would you like to try to talk to that point?
Yeah, I would say I believe it was on one of Bethany's slides where we broke it down, and there was 13 outside of our 80. There was 13 outside of key healthcare providers and systems, or the associations. And of those, I believe that the podcast had healthcare providers as people talking on them. For the 13 websites, I am not 100% sure, but I know of those, one of those is Medline Plus, which I would say, has an authoritativeness in their information. So I would have to get back to you on the rest of them, though. The leftover 10 or so.
Thanks, Alyssa. And George, you actually bring up a really great point, because something that we have learned through the research that we're doing, and also this work, is that there are so many patient groups out there. And again, Bethany's slide did allude to the number of Facebook groups that are out there. And, obviously we can't speak to what the authoritativeness of that information is being shared amongst patients is as well. So that's another, I think, really interesting aspect of not just patient groups for MAs, but of all patient groups, like how are other women informing people as well. I think that's really an interesting thing to consider. So we have another question from Emily. She asks, along those same lines, for the YouTube videos, was it patients sharing their experiences, or were they more official sources? Alyssa, I'll let you respond to that as well.
Yeah, so as part of my Dartmouth MPH program and for my thesis, we're actually expanding this part of the of our project here. And like I mentioned, we had 9,681 or something like that videos retrieved from the web scraper. Of those, only about 753 were patient focused. And we are still doing an analysis on those to determine if they were mostly patients sharing stories or more official resources. I will say there wasn't very much information from the associations or healthcare systems in general. Most were either healthcare providers talking about Mullerian anomalies or patients talking about their experience. But the actual numbers I don't have. We will be publishing that content analysis when we do finish. I'm hoping before December. So that will be forthcoming, and I can make sure to send that to George when we do have it submitted, so that way he can send it out to people within the region and show how we have continued to work on this grant funding that we received. Thank you so much. Thanks,
Alyssa. I think that's, oh, here we go. Another question from Sandy. Were any of the chat services, Twitter, Mastodon, Instagram, etc., queried? I'll let, again, Alyssa, thanks for responding, but I won't attempt to answer on your behalf. I'll just ensure, I would say no, but Alyssa, can you confirm?
Yeah, we did not do Twitter, X, or Instagram. I originally had wanted to expand to that, but it was like so much information, and a lot of it, you needed to log in information to use. It wasn't like available through search functionality. TikTok, we really wanted to do, but it is banned in Montana. So we decided that was not a good idea.
Mm-hmm. But yeah, Sandy, it's a great point. There is a lot out there, and in patients that we've spoken to, we know there are Instagram groups and other a lot of other sources out there. If there's nothing else, I might hand back to George, and just wanted to say, please feel free to stay in touch with us if you have an interest to be involved as a patient, or if you'd like to get us in touch with your providers who you think might be interested in this. We're really keen to expand our network and ensure that we can get this information where it needs to be. So thanks everyone on my team for participating today, and thank you, George, and I'll leave it at that.
Thank you, Miranda. That was a great presentation. I really enjoyed it. I just wanted to say, like I said, thank you. And please join us for our next webinar on November 16th at 1 p.m. Mountain Time. Representatives of the Health Resources and Services Administration will discuss the Rural Health Information Hub, better known as RHI Hub. This national clearinghouse provides access to current and reliable resources and tools to help you learn about rural health needs and work to address them. The website offers a library of resources, coverage of rural issues, state guides, evidence-based toolkits, program models, and more. That's November 16th at 1 p.m. Mountain Standard Time. And please take a visit to our website, nnlm.gov. You will find training and funding opportunities available there. We are in the process of we just announced our year 4 funding opportunities, which will be the year starting May 1st, 2024, going into April of 2025. So you will find that funding for projects in engagement and outreach, technology, and professional development. So please visit nnlm.gov or get in touch with me, and I'll be glad to tell you more about it. Like I said, thanks to our speakers and thanks to all of you for joining us today. The evaluation link for today's session is shown on the slide. I've put it in the chat, but I will put it in there again. Please watch for an email with a link to the recording. It will take us a little while to get the captioning for that, but once we get that, we will put that on YouTube. This project has been funded by the National Library of Medicine. NLM and NNLM are service marks of the U.S. Department of Health and Human Services. With that, I'll say thank you, and please enjoy the rest of your day.